Here we see two simulations about to be run. We have ether at the top and sevoflurane at the bottom. We're going to begin that anesthetic by hitting run all. And we're going to see the anesthetic levels come up to the 1 MAC level in the vessel-rich group in ether. And we get it there also in sevoflurane. Sevoflurane had a little bit of overshoot in the alveolar concentration. Ether did not. We can see that on these two curves as well. At this point, I'm turning down the vaporizer to a more reasonable value and continuing the simulation. So with the vaporizer setting lower than it was before, we've got the patient at a constant depth of anesthesia, and notice the large gap between the inspired or vaporizer concentration and the alveolar concentration for ether, because it is so very soluble. Now, at this point, we ask ourselves the question, is there any danger of this high solubility? Is there any danger with having the inspired concentration so high compared to the expired concentration? The answer is, let's see what happens if we hyperventilate both of these patients in the middle of the anesthetic. I shall do that now. So the ventilation has gone up, the ventilation has gone up. The expired concentration of ether is going up dramatically, whereas for sevoflurane, it's remaining almost exactly constant. Any insoluble drug will have this property, and any soluble drug will have that property. If we look at the overlay, show alveolar over MAC, we see that in the case of ether, alveolar gets much, much above MAC, probably enough to cause some cardiovascular problems. Whereas with a less soluble drug, we get a very constant level in the alveolar compartment and in the vessel-rich group.